At midnight, both of your kidneys shut down. You do not drop dead. You might not even wake up. But before breakfast, the chemistry that keeps your nerves, muscles, lungs, and heart working has already begun to drift. The most dangerous change is not a mysterious toxin. It is an ordinary mineral your body needs every day: potassium. Here are the rules. Both kidneys suddenly fall to essentially zero filtration and make no urine, while your other organs begin healthy. This is an extreme version of acute kidney injury, not the usual slow path of chronic kidney disease. There is no universal countdown. The pace depends on your health, the cause, intake, medicines, and treatment. Normally, your kidneys run a non-stop chemical sorting plant. Blood reaches roughly 1 million filtering units in each kidney, called nephrons. Their filters let water and small molecules pass. Tubules return what you need, remove extra acid and minerals, and send the remainder to the bladder as urine. Together, healthy kidneys filter about half a cup of blood every minute. At 12:01, that sorting plant goes silent. Other organs still work, so there is no instant collapse. Your bladder may still contain urine made earlier, creating a false sense that everything is fine. After that, urine output becomes very small or stops. Inside the bloodstream, every meal, drink, and working cell keeps adding material that no longer has a normal exit. First, think about water and salt. You continue to drink, and your cells continue to create water through metabolism. Normally, the kidneys adjust urine almost minute by minute to keep the volume right. Now that control is gone. A single glass does not instantly flood the lungs, but fluid begins accumulating. The scale rises. Rings feel tighter. Ankles can swell. Blood pressure and the workload on the heart may climb. Potassium is the faster electrical threat. Your muscles and other cells constantly release small amounts into the blood, and food adds more. Healthy kidneys remove the excess. With zero filtration, potassium can rise, sometimes slowly, sometimes frighteningly fast, especially if the illness that stopped the kidneys is also damaging cells. Too much potassium changes how heart cells reset after each beat. The rhythm can become weak, chaotic, or stop without much warning. At the same time, ordinary metabolism keeps producing acid. Healthy kidneys remove that acid and regenerate bicarbonate, one of the blood's chemical buffers. With the kidneys offline, bicarbonate falls and metabolic acidosis develops. You may feel nauseated, weak, or foggy. Breathing can become deeper and faster as the lungs try to lower carbon dioxide. That compensation buys time, but the lungs cannot perform the kidney's entire job. Fluid can now become a breathing problem too. Extra salt and water expand the circulation, then leak into tissues. If enough reaches the lungs, air sacs that should hold air begin filling with fluid. Lying flat may feel worse. Each breath becomes work. This is pulmonary edema, and it can become an emergency long before the slow hormonal effects of kidney failure, such as anemia or bone disease, have time to develop. Then come the wastes grouped under the word uremia. As hours become days, nitrogen-containing waste and many other compounds accumulate. Appetite fades. Food may taste wrong. Nausea, itching, drowsiness, and confusion can appear. In severe, untreated failure, the brain can malfunction, seizures can occur, and the lining around the heart can become inflamed. But the order and timing vary, which is why a dramatic exact death clock would be fiction. In real life, doctors would immediately ask why both kidneys stopped. Is blood flow too low after dehydration, bleeding, infection, or heart failure? Did a toxin, medicine, inflammation, or a lack of oxygen damage the kidneys themselves? Or is urine trapped behind an obstruction? These causes can look similar from the outside, but the right rescue is completely different. In the emergency department, the first picture appears on several screens at once. An electrocardiogram looks for potassium's effect on the heart. Blood tests check potassium, bicarbonate, creatinine, and urea. Urine is examined if any can be collected. An ultrasound or bladder scan searches for a blockage. Doctors also review blood pressure, fluid status, infections, medicines, and recent injuries. No single number tells the whole story. Treatment begins by attacking the cause. Low blood flow may require carefully chosen fluid and circulation support. A blocked ureter or bladder must be drained. A kidney-toxic drug is stopped. Infection or immune injury needs its own treatment. If dangerous potassium is already affecting the heart, emergency medicines can stabilize heart cells and temporarily move potassium back inside cells. That creates a window. It does not restore filtration. Now the team asks a more important question then. What is the creatinine? Are there life-threatening changes in fluid, electrolytes, or acid-base balance? Is pulmonary edema overwhelming the lungs? Is potassium resisting emergency treatment? Is severe acidosis or uremia threatening other organs? When the answer is yes, kidney replacement therapy, usually dialysis, starts urgently. The decision is based on the whole crisis, not one magic laboratory threshold. During hemodialysis, blood leaves the body through tubing and enters a dialyzer, sometimes called an artificial kidney. On one side of a thin membrane is blood. On the other is specially prepared dialysis fluid. Wastes and excess potassium move across the membrane, while pressure removes extra water. The clean blood returns to the body. The machine can correct several immediate dangers, but it replaces only part of what healthy kidneys do. Dialysis is support, not an instant cure. If the shutdown came from reversible low blood flow, a removable obstruction, or kidney tissue that can repair, urine production may return over days or weeks and dialysis may be stopped. Other injuries cause permanent loss, requiring ongoing dialysis or a transplant. Recovery depends on the cause, the severity, the person, and how much damage happened before circulation and chemistry were controlled. So what happens if both kidneys shut down overnight? At first, surprisingly little on the outside. Then the margin for error shrinks with every drink, meal, heartbeat, and hour. Water loses its exit. Acid loses its regulator. Potassium loses its safety valve. Your kidneys are not simple trash filters. They are silent chemistry managers. And when both go offline, medicine must replace that management before the rest of the body loses control.